Welcome to a live stream of the Chamber's COVID-19 and Your Business program. I'm Dave Eckman, President and CEO of the Greater Wausau Chamber of Commerce. I'm pleased to be joined on the UWSP at Wausau campus this morning by our speaker, Joan Theurer. Joan is the health officer at the Marathon County Health Department. During this program, Joan will share information on the coronavirus and how businesses should operate during this time. Following your presentation, we will conduct a question and answer session. Questions can be sent by email during the live stream to Brian Otten at botten@wausauchamber.com or sent by text to 715-370-0115. This program will be recorded and placed on the coronavirus resource page on the wausauchamber.com website. So with that, what I'd like to do right now is turn it over to Joan Theurer from the Marathon County Health Department. Joan?
Hi. Hi, everybody, and thank you, Dave. Appreciate the opportunity to speak with the business community and the efforts the Chamber is doing in terms of getting the word out, in terms of what does it mean for our businesses, our families, and our communities in terms of what we are being faced with. So thank you.
You're welcome.
COVID-19 has and continues to create social, economic disruptions and uncertainty for our health, the health of our family and communities. What is being asked of residents is not what many of us have experienced in our lifetime. That is collective sacrifice as a community, as a state in the United States. If we think about it, it's not really been since 1950s with polio has this been asked of United States residents and our businesses. This virus knows no zip code. Fear drives us as individuals to close in and turn away from others. Our number one job as community leaders is to manage that fear. As leaders and business owners, we can manage fear by providing timely, accurate, and consistent information. As employers and community leaders, you are in a crucial role in managing fear, communicating what residents must and can do to protect themselves, their families, and their communities. Our time together, I'm going to provide you what is called a situational update. I'm going to share what public health with our community partners are doing, and most importantly, what your contributions will look like in managing our response, as well as leave time then to address questions you may have. Next slide. In terms of kind of where we are, when we talk about coronavirus, you probably heard early on talking about it being a novel virus, and what that really means is it's a new virus. And because it's a new virus, little is known about the respiratory, this virus, and much is to learn about the severity of it. One thing that we are learning is that older adults and people who have underlying health conditions are at increased risk for developing complications from COVID-19 illness. We know that it spreads to others when infected persons are coughing or sneezing and someone is touching objects with the virus on it and then touches their mouth, their nose, and their eyes. We also know that community transmission is occurring. Yesterday, in looking at the CDC site, which we'll be showing you later, we now have 18 states where there's community transmission. And when I say what is community transmission, it means we don't know the source, as well as there's widespread outbreak occurring. To date, 54 states, or I should say jurisdictions, in all 50 states are reporting cases. We have 7,038 cases and 97 deaths. And this is based upon data from CDC as of yesterday. Testing availability in Wisconsin in the past 2 weeks has been occurring. We have the State Lab of Hygiene up and running, and we have the City of Milwaukee's lab running, and there are private labs that are in the process of getting themselves up and running. So what does that mean? It means that we're testing more, and because we're testing more, we are going to be finding cases. Here in Wisconsin, as of yesterday, we have 14 counties now where they have one or more case and 106 cases. And the cases are occurring from Brown County, Dane County, Fond du Lac, Kenosha, La Crosse, Milwaukee, Outagamie, Pierce, Racine, Sheboygan, Washington, Waukesha, Winnebago, and earlier this week, Wood County. So in terms of where we're finding cases, Wood County is the closest that we have as of yesterday to Marathon County. The other thing to keep in mind when we look what is happening here in Wisconsin, we have 3 communities again where there's community transmission occurring, again meaning we don't know the source for some of the cases that are coming in, and those are Milwaukee County, which has 47 cases as of yesterday, Kenosha 4, and then Dane County with 23. And we'll talk a little bit more about what the implications are when I talk about community transmission. Key goals for us in terms of our healthcare system as well as a nation in our response to COVID-19. They are, we want to reduce things like hospitalization and death. We want to minimize disease transmission, meaning how it's being spread from person to person. Importantly is we want to protect our healthcare personnel. We want to preserve our healthcare system and its functioning. And we want to reduce the burden on lost wages, productivity, and economic impact. Next slide. Okay. Just to kind of give you a timeline of some of the events that have been occurring, and there has been a lot of rapid activity in the past week. On March 13th, President Trump declared it a national emergency. On March 16th, CDC recommended canceling and postponing events that consisted of 50 or more people for the next 8 weeks. On March 17th, President Trump issued guidelines for America. And with those guidelines came things like staying home. It had to do with having gatherings of no more than 10. And in turn then, Wisconsin has had a series of proclamations and restrictions that have been rolling out. As of February 5th, we had our first case in Dane County. March 4th, testing expanded into Wisconsin and across the United States. March 12th, Governor Evers declares a public health emergency. On March 12th, the Department of Health Services issued a statement that there should be no gatherings of 250 more people. And then on March 13th, our Secretary, Department of Health Services, ordered closures of private and public schools. And then on March 17th, furthered saying that those schools would be closed indefinitely during the duration of this public health emergency. On March 16th, our Secretary again ordered prohibiting mass gatherings of 50 people or more, and then the following day, in light of the recommendations at a national level, ordered no mass gatherings of 10 or more people. On March 19th, which was yesterday, the Secretary further ordered that in terms of childcare, that there would be no more than 10 staff present at a time and may not operate with more than 50 children present at one time. So you can see there's been a number of events that are, in a sense, and they are, restricting our movement. And I'm going to talk a little bit about why we're doing that and why that's so important, because I'm really looking to you as business leaders to help your employees and other individuals you interface with on a day-to-day basis to understand why we are doing what we're doing. Next slide. This slide kind of shows you, when we talk about pandemics, what we are in a sense, figuring out. And we look at two aspects of it. One is how easily it is transmitted from person to person. And some viruses are more easily transmitted, whereas if I'm sitting next to Dave 2 feet away for 2 hours, he might be at a greater risk for a particular virus versus another one where I could sit with Dave for an entire day and he would not be as a greater risk. So that's one area that we're looking at. And then the other thing we look at is severity. And when I talk about severity, it means people coming down with illnesses and that compromises their body to the point where they have to be hospitalized or may result in death. And just to give you some perspective, the 1918, which you've probably been hearing about, the pandemic flu back then, called sometimes the Spanish flu, there were 50 million deaths worldwide, and in the United States alone, 675. That pandemic, the 1918, was considered severe and easily transmitted. Some of you may remember in 2009, a pandemic called H1N1, and you can see on the chart, moderate in terms of transmission and not severe. The challenge we have right now is this is a new virus, and until we can learn more about it, we don't know where to plot it on this graph. And that is why we're taking the measures we are at this point in time. Next slide. This slide really talks about why we've taken the measures we have in the past few weeks, why we are restricting movement. And this is something I think if everybody can have this roll off their tongue, we will all benefit from having greater patience and understanding for many of the restrictions we are experiencing. We need to slow the peak. And why is this important? You can see that if we do not carry out measures that restrict people from interacting with each other, what happens is that peak dramatically rises. Our goal is to slow and flatten that peak. And I'm going to talk about why that's so important. There's two reasons. If we don't flatten the peak or slow it, we're going to overload the demands on our healthcare system. So clinics and hospitals, long-term care facilities, they were not built to handle the volume of patients we see in a pandemic. We also want to avoid overloading our public health system. Again, local health departments such as Marathon County Health Department, we do not have the infrastructure to follow up on significant surge of cases. When you think about it, overloading the healthcare system will result in delay in testing, delay in treatment, an increase in the number of individuals who will be hospitalized, as well as resulting in an increase in deaths. The other thing to keep in mind is we still need to provide healthcare services for what we do on an everyday basis. So if somebody's having a heart attack, somebody broke their arm, those services still need to be in place. In terms of overloading the health departments, we will not be able then to follow up as quickly as we want to in case investigations and quarantines, resulting in increased community spread. So if we and everybody, including businesses, are role modeling, carrying out containment and mitigation measures, we will, in a sense, slow the peak. So things that we are asking everybody to do is stay home when sick, wash your hands, cough etiquette. So that means cough into your elbow, use tissue. We're restricting travel, closing schools, not allowing mass gatherings of 10 people or more, closing bars, restaurants, and expecting people to take out and use delivery services. These are proven measures that have been used in the past where we know we can reduce that spike. Measures that we are taking seriously in order to protect you, your employees, their families, and our communities. Next slide. Just to kind of give you an overview of what efforts have been underway for planning for pandemics. And I'm just going to highlight a few of these. This is kind of the big picture overview of what local health departments with our healthcare partners and other sectors have, in a sense, put in place in terms of plans that we can then execute in the event we have a pandemic such as what we have underway here. I'm going to spend a little bit of time talking about surveillance, epidemiology, and laboratory activities, just to give you a better understanding of kind of the infrastructure that is in place in local health departments, within state health departments, and within CDC. So right now, when individuals are being tested by state law, that is to be reported to local health departments within 1 working day. Health departments then are required to follow up with the individual to reinforce they are to stay home for 14 days. We're asking the individual during that time to make sure they have adequate food and their basic needs are being met. The individual is responsible for contacting their employee. We will not be contacting you. Your employee is being asked to tell you they are being tested and being asked to stay home for 14 days. As a health department, we will provide a statement to that employee that they can share back to you at the point they're released from that quarantine or during that time. And depending on the risk, the individual may be released sooner than 14 days if the test is negative. And again, that depends on, we have these formulas that we work through in terms of whether or not the person can be released or not, even with a negative test within that 14 days. For individuals who are tested and positive, meaning they have COVID-19, the health department will contact the person within the day, and then what our job is to obtain a history. So we're going to have a conversation with that person. We're going to ask them when did they start having signs and symptoms, and then we're going to do a history about where they've been, who they've been with, and in those encounters, how much time did they spend with that person, how close they were with the people they were with. This is called a contact investigation. And just to let you know, health departments, we have experience in this. This is something we do for any disease that is reported into a health department. And just to give you an example, here in Marathon County, we experience about 1 to 3 cases of TB in a year, and this is exactly what we do when we have a TB case. So you can keep in mind, these are services and activities that have been occurring in our community prior to COVID-19, and we carry them out and we know we've been successful when you, the public, don't even know that it's happening. The individual's employer then, we will be in contact with you, and what we're going to do is basically review the information we've obtained from the employee with you as the employer in terms of close contacts. We will then work with you to determine who needs to be notified and then also quarantine. Anyone who has had close contact with an employee determined by our criteria will be asked to stay home for 14 days and seek medical care if they become sick. So we've already talked about community mitigation measures, which is another activity or function that we carry out in a pandemic response. In terms of healthcare systems preparedness, I just want to share that At a national level, state and regional level, we've had in place what's called regional healthcare emergency readiness coalitions. I, along with several other members from Marathon County, sit on a board. It's a regional coalition, and for the past 5 to 6 years, various sectors sit around the table, and what we do is we basically have been planning for public health events such as this, as well as mass shootings, extended power outages. And the goal is to look at how do we create plans that we work from jointly. So our healthcare system partners, Marshfield Clinic or Marshfield Health Systems, Aspirus, Ascension, and Bridge Community Health Clinic, working in a coordinated manner as much as is possible. Likewise, sectors like EMS, our long-term care partners, emergency management, and local health departments sitting around that table. So we're fortunate to have that in place and coordinating some of the needs that are occurring within our healthcare system partners. We are also fortunate here in Marathon County. We have had and continue to have high quality healthcare systems in place. The last thing I wanted to touch on in terms of what we're doing is around communication and public outreach. As I stated earlier, given the unknowns, uncertainty, it is critical public health and healthcare systems partners provide timely, accurate, and consistent messaging on what we know about the virus, what is being done, and what employees as well as the public can do to be safe. We have here in Marathon County established or basically activated what's called public information officers, and from our critical healthcare system partners as well as at a government level, we have key people identified where they are sharing information across and to each other, so there's consistent messaging that's occurring in our community. Marathon County Health Department, and I'll get to that in a few minutes, we have a landing page with information on COVID-19. We've also launched a Facebook that is dedicated to this as a way to ensure that we're pushing out credible and reliable and consistent information on this. Next slide. So I'm going to spend a little bit of time talking about what you can do. And I want to, again, point out that the Chamber did push out a fact sheet on this, and I would just encourage, if you haven't taken a look at that, please do so. It's also posted on our website, which I'll walk through in a few minutes. So a couple key things that you need to be thinking about continuing to do, because I know many of you already are in the process of doing this. One is to create a business continuity of operations plan. When I scheduled this with Dave, I thought we would have more time than we do. Some of the things that I'm going to talk about are already you're being faced with this week because of the restrictions that have been put in place around movement. So first thing is to continue to think about how are you preparing your business for disruptions that are occurring. And those disruptions can be occurring from two different aspects. One is because employees are not able to show up because of childcare or because of illness, and the other aspect is because of restrictions that have been placed on your business. The other part of this is to relook at what your leave policies are. Can people work from home? Can there be adjustments made in shifts to accommodate childcare for those where they do have to show up at the workplace because that's the nature of their work, as well as how do we become creative in our childcare. And I'm going to just pause here and have Dave talk a little bit about some of the things that the Chamber has done, particularly around childcare.
Sure. Thank you, Joan. So what we are working on right now for all businesses, you do not have to be a member of the Chamber of Commerce. We're here to serve the community. We're working on having resources pages put up on the the WausauChamber.com website that will help to serve you with respect to the things that the Economic Development Corporation of Wisconsin is doing, the Small Business Administration, but then to get to the child care. We're working with our partners in this area. We know child care is going to be a significant challenge for your business, your employees, and their families. So we are working on a landing page that we will formalize today, but we're collecting and creating directories and allowing businesses to say, hey, we want to sign up and we want to be able to access professionals doing child care, certified babysitters, things like that. And we're working with organizations in our community to ensure that when we start to create these directories, that we're bringing people to the table that have experience or are certified child care providers or babysitters. We want to make sure the safety and security of families, people that work for you are in place. So essentially we're creating a matchmaking opportunity that will help your employees connect with these valid child care organizations to find resources to bring child care professionals either into the home or perhaps taking some of your children to a certified child care provider. And that's to be worked out between parties. But you can look to that on our website.
Okay, thank you, Dave. So back to what you can do. The other thing is reinforcing employees to stay home when sick. In reinforcing hand hygiene, respiratory etiquette, looking at what are your practices around routine cleaning as well as shift assignments. So allowing time between one shift and another shift of workers coming in where there's ventilation and air movement. Equally important is how do we help prepare our employees? Everybody right now is being asked to rethink and redo how they live on a day-to-day basis, and it's extremely stressful for everybody. So if you can share what you're doing, share what they can do, and let them know resources that are available. And I just want to have you drive people to 211. Marathon County United Way has what's a service called 211, and they have a wealth of information about resources that your employees can access. And I'm also very aware that we have a number of employees who are being displaced, who are low income, and things like where am I going to get money to pay my rent, to pay my mortgage, to obtain food is a reality for many of our employees and our residents. So 211 is a great resource to help employees seek out services. The other one is to be informed and use credible resources, and we'll walk through that when we're done here in terms of the resources that are available to you. And my last ask of everybody is to be supporting county and state containment and mitigation efforts. Believe me, these are things that is tough for being asked of everybody. And the purpose really is to flatten that curve. And if you can help people to understand why it's so important that they carry out these measures, you will have done a great service, not only to your employees, but our communities. So again, talking about why we are closing events and gatherings, talking about the need for being aware of travel. I'm going to spend a little bit of time on that. And in the fact sheet that you were given, there was some information as well provided on travel. But I would ask you to start taking a look at what your own business practices are in terms of travel for work. I know many companies are also looking at expectations around travel for personal. In the state of Wisconsin, we have more restrictions than at a national level. At a national level, let me back up. At a national level, on the CDC site, they talk about if you are traveling in certain parts of the world, when you come back, you will be quarantined for 14 days. The state of Wisconsin actually has become more aggressive because travel is one of the ways this virus is getting spread readily. And so in the state of Wisconsin, we are also asking that if somebody returns from a state where there's substantial community transmission, that they also be quarantined for 14 days. And earlier I shared that we have a number of states where that is, where there is community transmission. So before I get into the websites, what I wanted to do is just kind of close with a quote here that if you can move to the next page, I think is worth, again, for us to remember. This is the first time since the 1950s we, as residents, are being asked to make a collective sacrifice. And some of you may have heard Dr. Anthony Fauci. He's the director of National Institute of Allergy and Infectious Disease. He's, the other day he shared, he's 79 years old. I wish I had the vitality of that person, because I could really use it right now. But he has this, he's been saying this quote, and I think it's really something we need to remember. There's no shame in overreacting. It is best to be in a position where we overreact it versus underreact. So with that, I want to just leave you with stay safe and be good to each other. So with that, we'll walk through some of the key resources you have available. We're going to start with Marathon County Health Department. So if you Google Marathon County, you'll come to the landing page for the county. Click on the COVID-19. So Chris, if you could click on, nope, if you could go back to, I'm sorry, back to Marathon County, and then click on that, there we go, title page. And so when you scroll down, you will see a wealth of resources available to you. The green boxes, if you could just click on At Work, thank you, Chris, drives you to the CDC sites in terms of resources available for you. I know we've been fielding calls around how do you clean and disinfect. It's there for you, as well as guidance for your workplace. So Chris, if you go back to Marathon County again, and then on the blue are personalized things in terms of additional guidance for you. And then if you can click, scroll down to fact sheets, and there's one there on workplace. If you can just click on that one, Chris, what you can do in your workplace. And this is basically the prettier version of what the Chamber pushed out last week. Mm-hmm. But again, some great resources and things for you to look at and be reinforced in terms of practices you can take place. Chris, if you can go back to that landing page again, Marathon County. And then there's also some information about how you can give to employees in terms of how they can prepare their household as well. Chris, then if you could go to Department of Health Services. Okay, and then we'll just wait for the coronavirus to appear. I think it's the next slide. If you could click on that and then scroll down and keep scrolling, you will see a variety of information sheets for you. I want to point out the travel guidance one. So Chris, if you can look at travel guidance, general. This is the guidance that I would like you to be aware of for employees who are traveling for not only for work, but for personal. We have a number of people who have left the state to go to various parts of the United States, and it's important that you know upon their return, were they in a community where there was substantial community transmission, because they need to go home, stay home for 14 days. So this is where you could find your resources. And then lastly, I'm going to, Chris, if you can go back to that up on the top, and then scroll down a little bit further, and then click on outbreaks in Wisconsin. So if you scroll down on that, this is where you can find out where cases are in Wisconsin, and you'll see little asterisks next to Milwaukee, Kenosha, and Dane, and what that is indicating, if you read down, basically those are communities where there's community transmission, meaning we don't know the source of some of the cases that we are finding. Lastly, then, I'm going to have Chris go to the CDC website. Okay. And if you can just scroll down a little bit, a wealth of information here. So if you're looking for something, you can't find it on the state website, I would encourage you to go here. This is the map that I've been talking about in terms of how you can determine where there is substantial community spread. You will see the site looks at not only case count in terms of range, and when you hover over, and I'm not sure why it's not working, but if you hover over like Chris is doing right now, it will come up and tell you the number count, as well as whether or not community transmission is occurring. So I just encourage you to go here and become familiar with this and get comfortable with this. And just to give you an example, yesterday, 2 days ago, the communities that, or the states that had community transmission was Washington, California, and New York. Yesterday when I went on, we have 18 states now. So to give you an example, Washington, Oregon, California, Nevada, Wyoming, Nebraska, Minnesota, Iowa, Mississippi, Louisiana, South Carolina, Illinois, Michigan, New Jersey, New York, Massachusetts, Maine, and New Hampshire. So what that means is if you have employees that are returning from those states in the last 14 days, they are to be self-quarantined themselves at home. So with that, I'm going to stop at this point, and I know we have some questions.
We do. First, I want to thank you for sharing your time here today. I can tell those in the audience that we've had the opportunity to work in the past on the various projects in this community, but your organization, you and your team are doing wonderful work in this community, and we appreciate everything that you're doing.
Thank you.
So we do have one question right now from Robert Hyman, from Senior Vice President of Human Resources at Aqua Finance. And Robert's question is this, Joan: what happens to the place of business if an employee that had been working recently was diagnosed with COVID-19? What procedures and protocol are put in place? So you've demonstrated some of the sites and guidance, but are there specifics that you can help maybe walk through with these employers?
Yeah. So as I said before, if we get a case, our goal is to get to that employee and do an interview to determine who are close contacts. So if they are in a place of employment, that would be a conversation, then we'd get on the phone with that employer and confirm what the employee said in terms of close contacts. And then we would work with you to attain the name of those employees, and then we would be in contact with them to let them know they need to be self-quarantined. What you can do on your end to prepare for that is to know where your employees were. So So if they travel around, where were they in various dates and who and what locations they were at. If they work within a work site, manufacturing, where were they on the lines? Who were they around with? And did that change from day to day, or was it a consistent set of people throughout that period? So that's one thing you can do, is be prepared to provide that information in a relatively quick manner.
Okay, thank you. Here's, I think, another important question, because, and I think at the onset of this, you made a very strong effort to demonstrate why this is important. And in our community, there's some that have not readily accepted this. And so, how should a business handle an employee who seems to show disregard for following any of the new rules associated with fighting the spread of this virus?
They may want to get on the national news and start looking at other countries, what has happened when you don't get on top of this quickly, whereby you have cities, countries that are quarantined. For example, in New York, there's perimeters around certain parts of communities in New York, literally where law enforcement is set up and people cannot move outside of those perimeters. I think too, to help people understand that our healthcare systems were not built for handling the volume of patients they will be seeing. And what that means then is, if you or your family member have a heart attack, a stroke, have influenza, I think that's the other thing to keep in mind right now too, is we still have not peaked from our influenza season. This has been a hard season, meaning we have lots of cases of influenza. Our healthcare systems are already stressed from that. So now you put this on top of that. It just means you're putting yourself, your family, and your community members at risk for not being able to obtain health care when they need it, whether it's for routine, for a heart attack, stroke, a broken leg. It will result in delay. It will also result in people making hard choices for who will receive care if they do have COVID-19 already. And I don't want to scare people, but I think this is our reality in terms of equipment, things like masks and ventilators. So other countries are having to make hard choices about who they're caring for.
Okay, thank you. One last question. We know that the restaurants have been closed, but some are opting still to deliver and or have pickup service. And so, is there a recommended practice? So as a company might be bringing in, or a person might be bringing in lunch delivered to their business, how should they handle that transaction?
I think, here in Marathon County, the health department does do inspections with our restaurants. And so as there's been questions around this, they've been reaching out, we've been reaching out to them. I think the practice is, they show up, they set the food down, you pay for it, and try to minimize the transaction as much as possible.
Okay. I have no further questions at this time. This is being recorded, and for those who view afterwards, they can reach out to the chamber with questions, and we're going to work very closely with Joan's department and her professionals. They're hard at work, and so we're going to do what we can to help you to at least collect those questions, and then on a timely basis get them to you and back for answers.
Yep. And I would just encourage everybody, I know you have questions and you want answers immediately, and what I'm asking you to do is please work with the chamber and have them triage those to us. Just to give you a sense of our operations, we have 40 employees, about 38 full-time equivalents, and we still have essential services that we need to carry out because communicable diseases still continue to circulate, so we need to be able to respond to those. We also have what's called human health hazards that we need to be able to respond to, and we have a water testing lab that we need to also be able to support, as well as licensing for places that still are open. So we are right now in the process of redirecting our staff who aren't needing to carry out those essential services to be able to respond to what this pandemic. And so I'm asking for your patience in terms of getting information back to you and using the chamber so you don't override our ability to carry out what we need to carry out that's critical, and yet for us to be able to be responsive to questions that are coming to.
Joan, we had a couple questions come in from the audience that if we could. Yesterday we had an employee come back from Florida. Tomorrow we have another coming back from Jamaica. Other employees are concerned. Anything we can do to calm other employees' nerves about their coworkers coming in contact with them?
I think one thing you can do is make sure that employees are self-monitoring. So if they're returning, you can, just check on a daily basis with them and say, so are you monitoring for signs and symptoms? Reinforcing that if you are feeling at all ill, you need to leave. The other aspect is just encouraging everybody to wash their hands and good respiratory etiquette will go a long way.
Another question, and I think this is really an important factor in all of this. This is from Christine Reinebow. What is your recommendation for ways to stay mentally healthy if staying home for work?
Yeah, a very good question. I don't know how many of you have EAP resources. If you do, I would encourage you to look at how can you get those resources out to your employees. I know just what I would call inconveniences that some of us are experiencing. I know some folks it's more than an inconvenience if you don't have childcare and you're working at minimum wage and you don't have a job now. So a couple things. One is if you have EAP, I encourage you to look at how you can utilize those resources and push those out. I think the other thing too is normalizing that this is a stressful time and that our mental well-being is as important as our physical well-being, and just having a forum for people to be able to talk about the stress they're experiencing. And I also think what's really important is to normalize for people to reach out to mental health providers. And again, 211 is a great resource if people are looking for a provider. So conversations, supporting what people are experiencing is really important.
Okay, thank you.
Thank you.
So this will draw to a conclusion the program this morning, but I want everybody to know that this organization, the health department, and the communities, the municipalities, they're all working closely together with the business community, that we know we will get through this, and there's a lot of people working together to help this community and the state of Wisconsin to move forward in this. I would encourage our business partners, members and non-members, it's really very important to be clear that all businesses can access the chamber, our team, where we can serve and help you to get the resources and get your questions answered where we can, most expeditiously. Thank you to UW Stevens Point at Wausau and the team here for allowing us their space. And Joan, thank you for your time.